Do you agree with the president that Congress should wait for Scott Brown to be seated before taking any action on health care?
Oh, well, that I do. I think we should respect the results in Massachusetts, but we also should acknowledge that it's a reflection to some degree that we haven't done this job very well. You know, we have the unholy trinity at this point. We have Republicans who say they don't want to do anything at all. You have the independents who are genuinely confused about what it is we're doing. And then you have progressive supporters of President Obama like myself who feel that a lot of the best things that we had been talking about, like the public option, have been cast aside. So we have a little bit of a mess now, so I think we need to hit the reset button. There's no doubt about that. It's not just enough for us here in Washington to circle around the sausage-making factory and talk about what compromises we're going to make. We've got to talk in language the American people understand. You know, if you look at some of the most popular things that have emerged from this debate, things like the public option, people actually kind of like that idea of choice and competition. We jettisoned it as part of a compromise to get a senator on board. What we've lost sight of here in Washington is that the American people understand they need to get costs down. They want more choice. They want their insurance companies to treat them well. And somewhere in all of the machinations here, all of the insider deals, we lost sight of that, and we also lost a seat in Massachusetts to boot. I want to get the best possible health care that we can. My view is we should not let the perfect be the enemy of the good. All that being said is we should go down with a little bit of a fight here. I think the American people, the president kind of acknowledged this yesterday. He said that he hasn't done a good enough job persuading people that he understands this is part of the economy.
Okay, but I don't know. What do you propose, though? Do you pare it back? Do you do it incrementally?
Here's what I think. I think that we should pare it back to some basic elements and have the president go out and try to help us sell it. And those basic elements are: we need to restore choice and competition with the public option. We need to close the donut hole for seniors who are paying too much money for prescription drugs. We need to stop the abuse of the insurance companies by taking away their antitrust exemption. We go out with these basic things that we know are popular, and we get the president to give us some air cover, or whatever metaphor you want to use, by going out and talking about it. And maybe we do have to compromise, but at least we go down with a fight.
Congressman Anthony Weiner, always great to catch up with you. Thanks for joining us this morning.